Hi, Assalamu alaikum wa rahmatullahi wa barakatuh. I'm going to be doing a podcast today on stress and the brain gut connection and the gut brain axis. I'm going to keep this really simple and really straightforward. So, there's a lot of research out there. However, I have developed a program using years of work experience and academic knowledge. Alastal therapy was developed over several years, and I would actually like to start off with some client cases. This will help you to understand how people can have the same symptoms but different root causes. I also have to say that I do work under the banner of coaching, and I do coaching globally. So I have developed a program that is diverse using different modalities, and you can see the link in the description. So, client case number one, I had a lady come to me. She couldn't stomach anything. She developed a rash, potential skin condition. She had been to many doctors, and we looked into her diet, and she was eating healthy. And usually when I do basic nutrition changes, nutrition coaching, I give a very simple diet. I don't give anything extreme. So she was having an extremely healthy diet. So I thought, okay, usually skin conditions, you need to work on the gut, you need to change the diet. So I was like, this is a bit strange. So we did look into other areas of her life, and there was an issue in the family. Not a major issue, but there was an issue. So I did do family therapy. So what happened was, alhamdulillah, within 3 weeks, she was able to stomach food again, and her rash was going too. So basically, some stress had accumulated. Now, it wasn't severe stress, it didn't involve trauma. That's why it took 3 weeks. So it didn't involve trauma. So alhamdulillah, within 3 weeks, her issues were resolved. In another case, a client had severe gut health issues, low mood, insomnia, irritability, flatulence, and bloating. She felt uncomfortable when eating. She too had been to many doctors. We discovered her home environment was okay, parenting was fine. She had actually developed intolerances after she turned 40. So, and also she was watching distressing content on social media, and obviously this is 2024, so there's quite a few social media posts with distressing content on there. May Allah make it easy for everybody, I mean. So I can understand many women listening to this are also doing the same. They're watching distressing content, but my advice is that you reduce watching it. It doesn't mean that you care less. You don't need to immerse yourself into the distress that's going on in the current world. But what you can do is make dua, give sadaqah. A strong believer is better than a weak believer, and your body's an amana. So in this case, alhamdulillah, we eliminated all the foods we identified that were causing the issue, and she felt 90% better within 3 weeks, and her mood also improved. Now, there's some cases that take a lot longer. So there was a severe bereavement issue case, and the circumstance under which this adult female, her father had passed away when she was young, it was horrific. And she later developed an autoimmune condition, and at this moment you're probably thinking, where is the link? So she originally came to me for bereavement concerns. As we worked on bereavement, we worked on her health too, which included mental health and nutrition. So I mentored her in many different ways, using different modalities, and her mental health did improve around bereavement. Her symptoms also started to improve, and then many months down the line, this was a long-term case, her blood results did show an improved, that her autoimmune condition had improved. Obviously, she did feel a reduction in clinical symptoms too. So in terms of gut health, there is evidence on how poor food can lead to poor mental health, obviously. and also how stress can lead to poor mental health. Now, a poor diet is void of nutrients. You will eventually lead to multiple clinical manifestations like bloating, IBS, constipation, body pain, numbness, poor vision, poor libido, weight gain, etc. And you will develop deficiencies. And food that is highly processed, it's difficult for the digestive system to digest that food because there's so many preservatives, etc. in that food. And there's many like crisps like Takis, or there's drinks like Mountain Dew that are out there that have terrible E numbers in that cause catastrophic kind of side effects, breathing issues, hives, and in some cases even hyperactivity in children. So I think there's a lot of information out there that you can read up on in terms of nutrition, and I think it's really important to keep it simple. If you do want to make simple changes, you have to just start cooking at home, start reading the ingredients, and keep it simple as possible. So if you do buy anything packaged, always look for the alternative. So let's talk about stress. Some stress in our life is important. It drives us to change. It can motivate us. However, chronic stress can manifest. And it can manifest, for example, into stomach pain, palpitations, skin problems, endocrine issues, deficiencies, weight gain, insomnia, body pain, muscle tension. And it is important to know, and research has shown, several mood disorders such as anxiety, depression, and various others, they have a well-established link to functional GI disruptions. Whereas GI disease, like irritable bowel syndrome, irritable bowel disease, often involves psychological elements associated with the alteration of the gut microbiome. So the disruption of your gut microbiome or gut health can happen through several physiological and psychological mechanisms. Very important to understand that. And I think it's very important to keep the knowledge you gain simple. Don't overcomplicate it, okay? So the gut is highly sensitive to emotions and stress due to the connection between the brain and the digestive system, often referred to as the gut-brain axis, okay? So when you're stressed, for example, your body releases the stress hormones like cortisol, which can affect the functioning of the digestive system, and it can lead to symptoms such as cramping, bloating, pain. In addition, when you're super stressed, you can get muscle tension. And the muscles, for example, in your abdomen can become tense. So I have women and teenagers who tell me, I'm in this situation and I've got this knot in my stomach, or I'm not feeling well. Or you might have a teenager who has stomach pain every morning before they go. And obviously this needs to be seen to. And I always tell people, and I genuinely say, please seek early intervention before the situation gets worse. In addition, stress can lead to an increased level of stomach acid. Now, people always talk about alkaline state in the body, but in terms of your stomach, you need stomach acid to digest your food. But when you are severely stressed, chronically stressed, there's an increased production, and that can irritate the lining of the stomach, and it can also lead to acid reflux. And I've also seen that. So nowadays, everyone is like, okay, let's have multiple research studies to back up this information. But I've actually seen it with my clients, a reduction in reflux as we deal with the stress. In addition, some people do develop IBS, which is, affects the large intestine, and that's where you get the cramping, abdominal pain, bloating, gas, diarrhea, and constipation, etc. So, as discussed, when you're super stressed, you have an increase in cortisol, and this affects your digestion and metabolism. and it affects your gut motility in a negative way. So that can lead to constipation or runny stools. Your system, your body system, it can't get rid of the waste, and that's what leads to the bloating and stomach pain. In addition, most of your body's serotonin is actually stored in the GI tract, and serotonin helps with your bowel function, and it plays a role in protecting your gut. So it's very, very important to understand that several mechanisms are going on, and several mechanisms are affected when we don't manage our stress in an effective way. And like some stress, as I've stated, is very important. However, as I know through my clients, there are many who suffer from chronic stress. So in terms of understanding and managing stress, there's techniques such as mindfulness, relaxation, obviously, contact someone for therapy or coaching, and these can help alleviate the symptoms. So one of the things I tell a lot of women and teens is just first stop and breathe. Stop, breathe, and pause. A lot of us forget how to breathe properly. Literally just slow down. Think about your body and its limbs and how much you have used your body. Okay? Think about how many times you have used your hands today. Think about how many times you have used your legs. Think about how many times you have used your eyes over the last couple of weeks. Now, naturally, when you start to stop, breathe, and pause, you will start to practice gratitude. Now, I'm a big believer in faith-based wellness, so I'm going to introduce that at this point. Practicing gratitude and gratefulness is an important part of human life, and actually your iman. It leads to improved mental health and even interpersonal relationships. Gratitude is like medicine and a solution to irritation, anger, frustration, hostility, and even envy. Gratitude and gratefulness to Allah the Almighty, it's very, very important, and it increases dopamine in the body. It's like medicine. It helps with your sleep, it helps with your immunity, it improves your mood, it decreases blood pressure, it decreases anxiety, it decreases depression. You develop stronger interpersonal relationships, you have less loneliness, you have less isolation, and an increased level of optimism. And I think in many areas that people gain knowledge, they disassociate what's going on in their body with religion, and there's no disassociation that should happen. Our body is an amana. Now, if we learn how to manage stress, for example, and we develop new healthy habits, and part of the cure is habit, and I took that from the book by Ibn Qayyim rahimahullah, from the Prophetic Medicine book. Okay, you build new neural connections. Your brain chemistry changes when you develop consistent new habits. Allah subhanahu wa ta'ala, He created us in that way. So it's very important to reflect and contemplate. And I believe that it's not good to constantly go on social media because it confuses you and you always feel you're not doing enough. And that's what society wants, to make you feel you're not enough and you're not doing enough. So part of the cure is habit. Other factors you consider are, for example, targeting the root cause. That's something that I do with my clients. You can look at, again, deep breathing, exercise, learning to forgive like yourself or people, learning to kind of create healthy boundaries with certain maybe family members in some cases, or removing toxic friendships, and focusing on healthy food. That's really, really important. And last but not least, but definitely it's one of the priorities, you need to take some time out for your Quran. You need to focus. You need to work on your prayer. You need to work on your dua, your adhkar. And I think, it's so important when you wake up early in the morning. The first 30 minutes in the morning, I suggest you have a solid start. And it's some advice that I always give to myself. And sometimes we do kind of wake up and get straight into the multiple things that we need to do. But wake up, do some adhkar, read the morning dua, do like 10 minutes of exercise just to get your body going. And as a bonus, add some Quran in there too. So you're already ticking some boxes, inshallah. Another self-help tool is try to have a priority list. I have my prayers, I have my Quran, I have my healthy eating, I have my exercise, I have my good akhlaq and adab. For me, I also have my clients, for example, and obviously I have my children that I need to take care of, and then everything after that, you can decide what your priority list is, but you have to slow down and pause. So that means cutting back on certain things that are not high on the priority list. So I just wanted to keep this really short, and of course, if you have any questions, do leave them in the comment box. And I'm hoping to upload many more, so please do leave your feedback. Take care and have an amazing day. Assalamu alaikum.